Any day now, we will learn if the San Antonio VA healthcare system will be pulled deeper into the scandal that's rocked the VA facilities across the country.
That's because the VA's Inspector General's report is expected to be finally made public.
You may remember when the scandal broke, there were allegations that dozens of veterans died waiting for care at a Phoenix facility. But here in Texas, we've had allegations of manipulated appointment schedules, veterans missing appointments, and VA bosses taking home big bonuses. The head of the VA denies those claims.
But News 4 troubleshooter STACEY Cameron now has internal documents that calls her denials into question. It's tonight's Troubleshooters investigation.
A veteran of the first Gulf War.
I served in Iraq in 2003, and I retired at Fort Hood in 2004.
Today, Perry Jeffries manages TexVet, an organization helping veterans and their families access services and benefits.
We have about 1.7 million veterans in Texas.
Many of them, including Jeffries, listened closely when Brian Turner turned whistleblower. Here's what the medical support assistant from a VA clinic in San Antonio had to say this last spring.
My belief is that we are changing numbers in order for the VA to reflect that they have a shorter wait period time.
We're learning more now because of this audio recording given to News 4 San Antonio by a source inside the VA.
We're not aware of, certainly not from my position down, of asking any employees to cook the books.
Sources confirm that is the voice of Marie Weldon, director of the South Texas Veterans Healthcare System. Weldon is addressing claims against all VA hospitals from Phoenix to San Antonio at her quarterly staff meeting held on May 29th. She told staff on that recording she could not substantiate what Turner claimed was happening here with veterans' wait times.
If there's any mistakes that are made, it was based on absolute innocent error and confusion in the way that we have set this whole process up.
But 4 current San Antonio VA employees disagree. All 4 are medical support assistants, or MSAs. They say there's no confusion. They've been trained to hide wait times. They agreed to sit down with us in June if we disguised their identity.
Our appointment schedules at VA hospitals and clinics here in the San Antonio area being manipulated at the direction of your bosses.
Here's how our whistleblowers explained that MSAs, the people scheduling patient appointments, were able to hide long wait times. Say a VA patient saw a doctor on September 15th and needed a follow-up visit. Before leaving the hospital, that vet sees an MSA and picks a day to come back. Let's say October 1st. This is called the desired date. MSAs are supposed to schedule the vet's appointment as close to that desired date, October 1st in this case, as possible. But what if the first open appointment wasn't until October 31st? That means the vet has to wait 30 days longer than wanted to get care. But instead of noting that delay as required by VA policy, MSAs in San Antonio changed the desired date to the appointment date, making it appear that the veteran chose the much later date. Inside the San Antonio VA, our insiders tell us it's called zeroing out the wait time.
They taught us that way. Supervisor after supervisor instructed us to schedule by zeroing out.
Which is also what the original whistleblower Brian Turner claimed. And here's what Weldon had to say in her staff meeting about Turner's accusations.
As soon as we heard about that, we did a fact-finding and talked to the employee as well as his 2 supervisors, and we could not substantiate his allegations.
So we filed an open records request for that fact-finding. It took 2.5 months to get. The report is just 12 pages long. But in it, one of those supervisors admits that in May 2012, MSAs were treating the desired date and the appointment date as the same date. That practice they call zeroing out. Our whistleblower said it continued up through this summer.
In some areas it is.
The fact-finding report says those clerks were told to stop changing dates and were retrained. News 4 wanted to ask Marie Weldon whether more MSAs and scheduling supervisors should have been interviewed about zeroing out wait times. An answer we won't get because a VA spokesperson emailed us saying, at this time, we are not conducting on-camera interviews. The fact-finding also shows that one of Turner's supervisors was actually unfamiliar with how MSAs are trained, and the second supervisor was only asked about scheduling new patients, despite Turner pointing out that the problem is with return appointments. We've asked specific questions about those last two issues. So far, no answers. Congressional leaders tell us that when the Inspector General's report comes out, they will address the findings. When that happens, we'll be right here to report it. In San Antonio, I'm News 4 troubleshooter Stacey Cameron.